Good morning, everyone. Thank you for joining us for What to Know Wednesday with Indiana SHIP, the State Health Insurance Assistance Program. And today we are going to learn about Medicare's immunizations and which ones and how are they covered and how much do they cost. And to share that terrific information, we have my co-hostess, Megan Rogers.
Morning, everyone.
Thanks for doing this for us, Megan. It's really important, especially as we're coming up to fall and winter when, things, health viruses and bacteria can be flying through the air because we're not outside as much. I would invite folks to ask Megan questions by chatting them in, and I'll be keeping an eye on that as Megan is leading us through this presentation. So just chat in, folks, and we will get your questions answered. If you're not watching this live and you're viewing it at a later date on our Facebook page or our YouTube channel, we keep up with questions that are posted. So just because you're not live does not mean you can't ask us a question, and we will get back with you. So without further ado, Megan, tell us about Medicare's immunizations.
All right. Thank you, Susan. And yes, this is a perfect time for us to cover this topic because we are going into the fall months. I was visiting my dad at the nursing home yesterday, and I was like, well, you know what? You'll be getting your flu shot soon. And you had a COVID booster a couple months ago. And he's like, yep, I don't want to get sick. People are always sick in here. So he's getting protected and getting his shots because guess what, folks? These shots, these vaccines are not just for kids. We also have to get them as we age to make sure that we stay healthy from all those bugs flying around out there. Hold on here, I got to pop up here. Let me get rid of that. All right, folks. So what part of Medicare is going to cover these immunizations for us? So Part B, our outpatient medical part of Medicare, will cover some of these shots. And Part D, our drug coverage, will also cover some. So we're going to talk about which shots are covered by which part. And then if you're an individual watching and you have an Advantage plan, then these are also going to be covered for you. So anything that's covered by Part A or Part B is always going to be covered in your Advantage plan. So when I talk about Part B covered shots, it's in your Advantage plan. And then since we're talking specifically on immunizations and vaccines, if it's something covered by Part D, it will also be covered in your Advantage plan as well. So keep that in mind as we go along here. So Part B, what does Part B cover? So Part B is going to cover our flu shots, our pneumonia shots, our hepatitis B shots, the COVID vaccine, and any booster that you're eligible for. Some people are eligible for more boosters more frequently throughout the year if they are a certain age or have certain health risks. They're immune compromised. So as many of those boosters or as often as you're eligible for based on your health and your age, Medicare B or your Advantage plan will cover those boosters. Now, Part D. Part D is going to cover the shingles, tetanus, MMR vaccines, chickenpox vaccines, hepatitis A and hepatitis B. So hepatitis B is also covered under Part B Medicare services. That would be if you're a high-risk individual. If you're low risk, then the hepatitis A and B would be covered under your Part D part of Medicare. A vaccine for tuberculosis, meningococcal vaccines. They make these words a little hard to say, Susan.
I agree.
And then if there's any other vaccines that you are told that you need for travel that you're doing, especially overseas, then Part D is going to cover those as well. And we're going to talk about the shingles in a couple slides because I have some fantastic news on the shingles side for this year, but we'll wait till we get to that slide. So how much are you going to pay for these vaccines? Because some of these can be expensive. So if you are getting one of your Part B vaccines, the flu, the pneumonia, the hepatitis B, high risk, or COVID vaccine or boosters, then you aren't going to pay anything. There's no copay. Now, also what is important is where you get your vaccine. So that might affect what you have to pay, especially with the Part D side of the vaccines that are covered. So generally, if you're going to get, from what I've heard, and you can correct me if I'm wrong, Susan, but from what I've heard is, especially with the Part D vaccines, it's better to get them at the pharmacy than the doctor's office. The billing doesn't get as messed up, and we're going to talk about some billing glitches towards the end as well. And the coverage is usually cheaper at the pharmacy. But even though they have this line from the research I did on Medicare.gov, you know, about how where you go is going to affect the cost. Again, I just said Part B, there are no costs for those shots. And in our next slide, as of this year, your Part D shots do not have a cost either, including the shingles shot. That tends to be a very, was a very expensive vaccine. I think it's a two-parter, the shingles. And I think what I heard, the copay was around $200 some. So as of January of this year, if you are getting a Part D vaccine, there should be no copay. So keep that in mind. If you go to the pharmacy or the doctor's office, there shouldn't be a copay, from my understanding. But what happens if you do get a bill? This is, I don't know about you, Susan, but I frequently get calls or questions from clients and they go, well, I did get a bill for the COVID booster, or I have to pay for my flu shot or the shingles. And as of this year, there should be no copay for the shingles, and you shouldn't have to pay for your flu shot or the COVID booster or vaccine. And that is the same if you have an Advantage plan. And I can't stress that enough because, at least for me, those are most of the billing glitches that I see with clients. It comes from their Advantage plan. They still get a copay for the COVID booster or a flu shot. And whether you have original Medicare A and B and a Part D plan or an Advantage plan, you should not have a copay or a bill. So what happens if you do get a bill? Because these billing errors happen. There's probably 2,000 million different medical codes out there. And the doctors, the nurses, the business office staff has to make sure they put in the right billing code. And I don't have to put in billing codes, but I make a fair amount of errors when I send a simple email. So I can imagine how hard it would be to make sure you're clicking the right billing code every single time, because each diagnosis probably has multiple different codes that you can pick from. So they do happen. So make sure that you're opening your mail, your bills from your doctor's office, bills from where you may go to get your vaccine at, your Medicare summary notice that you get from Medicare, or your paperwork that you get from your Advantage plan that tells you what you've had billed under your Medicare number the last several months. Make sure that everything looks correct and there's no copay listed for you. If you do, most likely it was that billing code error. Maybe another issue that comes up is your doctor's office or the pharmacy doesn't have your correct insurance card on file. Or maybe you have a secondary, maybe you have Medicare and Medicaid, maybe you have Medicare and a supplement, or you just switched to an Advantage plan. You want to make sure that all your insurance information is correct and they have copies of all your insurance cards and all your medication insurance cards. You probably want to start with contacting your doctor's office or the pharmacy, making them aware that there's an issue. Hey, can you check the billing code? Or let's go over my insurance that I have on file. And then hopefully that will resolve it. Usually that's, at least from what I see, that does resolve it pretty quickly. And if it's still not resolving it, then you can contact your insurance company and try to address it with them over the phone or start an appeal with them. And that's something at SHIP we can assist with as well. So if you're getting a bill and you just don't know what to do, give us a call and we can walk you through that. Susan, are there any questions in the chat box?
Not so far, but I did want to make a point about, when you get an extra charge, that's one thing that may prompt you into investigating, does my provider accept Medicare assignment? Megan, tell us what that means and how should we make sure that we're going to providers who do accept Medicare assignment?
That's a great thought, Susan. Thank you. I completely forgot to add that to the PowerPoint. So thank you for bringing that to our attention. So Medicare assignment. So if a doctor says they take Medicare, great. They'll take your Medicare insurance. But what is key is that they also take assignment. So as we go to doctors, no matter what insurance we have, we're probably very familiar with getting the bill and it says, okay, the doctor's visit was $300. I only had to pay $20 and the insurance paid $105. Well, that doesn't equal $300. That's because the doctor is agreeing to take whatever the reimbursement is from the insurance. There's usually some kind of discount. And that's what Medicare assignment is. It means that the doctor is okay with taking your copay and whatever Medicare is going to reimburse them, which isn't always going to be the full office visit amount. So if they don't take assignment, it means that you pay your copay. Medicare is still going to pay the doctor their approved Medicare reimbursement amount, but then the insurance provider is allowed to bill you, the Medicare beneficiary, and correct me if I'm wrong on the percentage, Susan, up to an additional 15% on top of your copay. Is that percent correct, Susan?
Yeah, 15% is correct. And it's 15% of the Medicare approved amount.
Thank you. Thank you. I wasn't clear on that. So that clears that up for me too. So it's important when you have Medicare, not just to ask the doctors or the medical providers that you go to, do you take Medicare? You also want to ask, do you take assignment as well? And then to further complicate things, if you have an Advantage plan, it's not good enough to just say, do you take Medicare and Medicare assignment? You have to add on, do you take, and the specific name of the Advantage plan you're on, Anthem, Choice, Gold, PPO plan, because that's a specific insurance provider and you need to make sure the doctor is taking that provider as well. It's not just Medicare anymore, folks. It's a specific insurance plan. So make sure that you're checking those things when you go to a new provider. Even if another doctor is referring you to a specialist or another provider, they're not always checking for you to make sure that they're in network or they take that insurance. So you need to make sure you're asking those questions as well. Any other comments or questions, Susan, on vaccines?
Not right now.
All right. Oh, I got one more slide. I forgot all about it. I think I got a couple more slides. I thought I was done, people. Okay, so as we said, sometimes your vaccine could be covered under B or D. So let's kind of look at an example of this. So the shingles and the tetanus and the whooping cough vaccines are Part D vaccines. But we got to look at if it's to treat you or to prevent something. So in this example, if a patient gets a tetanus vaccine because of an accidental puncture wound, it's a Part B covered vaccine. However, if the patient gets a tetanus booster shot unrelated to injury or illness, it's a Part D covered vaccine. So it depends on what you're needing the shot for in some cases. And I was so excited when I ran across this example when I was putting this together, because I was doing a new counselor training a few weeks ago, and we were talking about Part B and Part D medication. And I'm like, you know what? I'm so confused, because some people at SHIP have told me that tetanus is Part B, but here it says Part D. So I don't know what's happening. I haven't had time to research it. So the person I was training actually researched it, and they gave me the answer, which was basically this. So it could be covered under either part of Medicare, or, you know, still bundled in your Advantage plan, depending on what you need the shot for. And this is just a quick summary slide that tells us again what shots are covered under each part. And then Susan and I, when we were going over these slides, we learned a new term as SHIP counselors, roster bill. We're like, well, what's that? And really, it doesn't have anything that you as the beneficiary needs to worry about. It's just a special way that a pharmacist can bill for multiple shots at the same time. So it cuts down on their paperwork they send to Medicare. So, you know, Part B, we've got our pneumonia, our flu, our COVID, our hepatitis, if you're at risk. Part D, we have the shingles, the Tdap, and then other vaccines that aren't very common, or like if you're doing traveling, and then the RSV, the respiratory vaccine. Susan, do you remember what the S stands for? Okay, yeah, I don't either. I meant to research it, but it's just that respiratory illness that you could get, and there's a shot for it. All right, so if you have questions or you need help understanding the vaccine coverage a little bit more, or you're getting a bill and you just don't know what to do with it, give us a call at 1-800-452-4800. You can follow us on social media like you're doing today. And as Susan said at the beginning, we do check our questions that get chatted in on these videos after we're live. So feel free to comment on the chat box, in the chat box, and we will get back to you as soon as possible. You can send us a Facebook message and we'll get back to you, or again, you can call us. Now, Susan, unless there's any questions, do you want to fill us in on what is coming up next with our lives?
Yes. And I'd like to thank you for putting this together. It was very timely, and I know I have a clearer understanding of what comes under what.
Mm-hmm.
So thank you. All right. Well, we only have one more Facebook Live program in August. And we are going to have a special guest, Dr. O. That's what we call her. She is going to be talking about advanced care planning. So that's a topic that many people might find of interest. So please share the information so everybody that you know who's interested in this can join us. And that's on the 21st of this month. That's a Medicare Monday, 10 o'clock Eastern time, just like always, live from our Facebook page. And soon we will be posting our September lineup, so you can mark your calendars for that. But unless Megan has anything else, we are going to say have a terrific day. And thanks again for joining us with Indiana Ship Facebook Live.
Bye, everyone.